it is all covered on those subsections. But comprehensively on paragraph or on the topic number 7, it's our collective observations and comments, where I would like members to be taken through that and also maybe add on or indicate where they want us to delete 1 or 2, and then go on to the paragraph that talks about recommendations, and then we can then take it from there. I was discussing with Ms. Majalamba that maybe 15 to 20 minutes, their presentations. If they need more, we can discuss that now. But let me then give that opportunity to Ms. Majalamba and her team to take us through. Thank you.
Good morning, Chair. Good morning to members and good morning to my colleagues. My name is Linda Ngomane. I'm the concerned advisor and I'll be taking you through the report. As requested, Chair, I will start at section 7, which is the committee observations and findings. Starting off with the National Department of Health, on the overall performance and reporting, the committee welcomed the 2023-24 annual report of the department and its entities. The committee commends the department for the slight improvement in performance, which is an improvement from 57% to 58.3% in the current financial year. The best performing program that was noted was program 6, which is health system governance and human resources, which achieved all its targets. Expenditure increased from 97.4% in 2022-23 to 99.6%, which is virtual. Almost the whole budget was used up. The committee observed that performance was not in line with the spending patterns. If performance was at 58% and the spending was at almost 100%, so that's not in correlation in terms of value for money. On audit outcomes, the department maintained its audit outcomes by obtaining an unqualified audit opinions with findings, and some of the findings are repeat findings, which includes the AG identifying errors in the financial statements, also the lack of proper consequence management for non-compliance to the PFMA, and the lack of reliability and validity of performance information. In respect to the audit of the provinces, the committee observed that Limpopo, Northwest, and KwaZulu-Natal have improved on their audit outcomes. However, Eastern Cape, Northern Cape, and Free State remains a concern. The committee expressed concern over the 359.3 million irregular expenditure incurred by the department, which includes 150 million relating to the Digital Vibes contract. Further to this, the committee requested that the Digital Vibes final report be shared with the committee. The committee also raised its concern regarding the Brainwave Projects SA contract valued at 122 million. The committee also observed that irregular expenditure incurred by the health sector, which the health sector includes the department itself and the entities, increased from 7.1 billion in 22-23 to 9.9 billion in the current year. I'm sorry, the health sector includes including the provinces. The committee noted with concern that an ongoing accrual in provinces remains a financial burden to the sector. The committee inquired about the strategies the department will implement to strengthen internal controls and accountability across the provinces. On service delivery and operations, concerns were raised regarding the prevention and treatment of tuberculosis, of which the committee noted the underperformance in this program. The committee inquired about the oversight mechanisms in place to ensure that clinics that obtain ideal clinic status do not regress. On PSC facilities concern was raised regarding the Guguletu clinic, as it poses a safety risk to staff and patients. The issue of foreign nationals was raised as a concern that it creates a strain to the health system. Active positions were raised as a concern at health facilities, demonstrated by the oversight in Northwest. The committee also raised that there are problems within the entities which relates to staff complaints and dissatisfaction. The committee requested the time frame for the full implementation of the health patient registration system, including syncing and connectivity. Concern was expressed on the lack of infrastructure improvements in public health facilities. Food safety was raised as a concern and about the role of the department in this regard. The committee inquired about the possibility of the department reviving the alcohol bill. The committee also wanted to know about the country's pandemic preparedness plans in light of the COVID-19 pandemic. The outsourcing of cancer patients' treatment in Gauteng was raised as a concern. The appointment of the CEO of BRRR is also a concern to the committee and wanted to know the department's intervention in this regard. In terms of the entities, starting with the SMRC, the committee commended the SMRC for obtaining clean audits over 9 successive years. It also congratulated the new CEO on their appointment. The committee also commended the SRC on fast-tracking the transformation agenda. The committee, however, expressed concern that cancer continue to pose a public health challenge and sought clarity on the collaboration of the MRC with other oncology units and institutes. On performance, the committee observed that that the reduction and fluctuation of annual targets were concerning and sought clarity on the impact of this trend on health outcomes. And also the committee sought clarity on the SMRC's progress in addressing non-communicable diseases. On Mine and Works Compensation Fund, which is the former CCOD, the committee commended the fund for achieving 98% of its targets. However, expressed concern over the regression in audit outcomes from a clean audit to an unqualified audit with findings. The committee noted the digitization of files. However, there are some files outstanding and wanted to know the time frame set to complete all the files. The fund's visibility in neighboring countries was flagged as a concern, and also the committee expressed concern over the unpaid funds of 10 billion and the steps that will be taken to disperse these funds. The inspection of mines and the plans to increase the pool of inspectors was also inquired by the committee. The fund was requested to look at innovative ways of tracking and tracing ex-mine workers for the unclaimed benefits. On the CMS, the committee observed with concern that the CMS has set itself a target of 60% to finalize commission inspection within 12 months, but didn't manage to achieve any of the targets during the period under review. The committee inquired about the strategy to ensure that PMBs remain relevant and responsive to evolving healthcare needs. Irregular expenditure was raised by the AG, and the committee inquired about the steps that will be taken to address irregular expenditure. Consequence management was noted as a concern, and it's a repeat finding. The committee highlighted that the HMI recommendations advances the need for affordable medical packages, and sought the viewpoint of the CMS in this regard. The committee observed that the CMS is experiencing ICT changes that requires additional funds, and they inquired about the full capacitation of the ICT unit and the funds projected to resolve the issue.
Yeah, Miss Roman, I was not expecting that you read word for word per area. Just highlight, don't read word for word. Okay.
Chair. And then the committee asked about the involvement of the CMS in the implementation of the NHI. On SAPRA, the committee observed the material impairments of 5.2 million. Also, the role of SAPRA in indigenous medicine, which is unclear, and there's backlogs in approvals. On the office of the Ombud, the committee noted that the Ombud is not accessible in rural areas, and also the use of digital technology is lacking. They then observe also that Gauteng has most cases. However, in terms of medical legal cases, Eastern Cape has huge number of medical legal cases. However, the complaints are not registered with the Health Ombud. The OHSC, the committee inquired about the use of artificial intelligence and data analytics to optimize inspections, and also the preparation of the OHSC for the NHI implementation. In terms of the recommendations, starting off with the National Department of Health.
Okay, Miss Ma, maybe let's pause here and get members to raise issues if they wish on this report tabled on our observation. I do notice it's written there in your report about the shortage of staff with the Office of the Health Office of Ombud. You didn't mention it, but anyway, it's highlighted in your report. It's there. So if members want to actually emphasize other observations that we made or that we have before we go to our recommendations, I will give that opportunity for now. By show of hands, if there's none, we'll move on to do the other part.
None, Chair. I think they're all captured.
1, 2, 3. Honorable Motubate, also. I saw your. Okay.
I'm here, Chair.
Yeah, I saw the bit of an opening of your video. Sorry, of your mute. I thought maybe you want to say something. If none, honorable members, let's move.
I wanted to say something, Chair. Sorry.
And then you'll be followed by Honorable Peko. Thank you.
Okay. No, thanks very much, and good morning to everyone. I actually wanted to make an addition. I didn't hear the Buitokong Swamp observation coming in on the request by the committee that we be favored with a full report regarding the building of the Buitokong Health Center on the swamp. I think that's but one issue that I identified. And on the question of the alcohol bill, maybe the recommendation would actually come up. We're actually asking about the possibility. We are actually saying and making a recommendation that the minister must bring back that bill. We are not actually asking, because when you say we are actually asking the possibility, it actually leaves room for exploitation. So we are saying that that particular alcohol bill we must actually retrieve it, dust it, and bring it to the committee. So those are and the other issue that we are actually raising was around exploiting nationalization of the Department of Health, because we've been overemphasizing on this particular issue, that we're having the National Health Insurance, and if we are going to have the federal approach on health, the implementation would actually take the period that it took for us to get us to where we are. Thanks, Chairperson.
Thank you. Honorable Teko, good morning.
Yes, good morning. Thank you very much for the presentation by the content advisor. Chair, I want us to go back to where we talk about foreign nationals hitting hard on the budget of the department. I just needed clarity to say, are we referring to foreign nationals or referring to undocumented foreign nationals, as it was the case when we were in Northwest oversight? My example would be the BRRR mortuary. Were we actually saying foreign nationals or referring to undocumented foreign nationals? Just clarity. I'm not saying we're wrong, but what we observed as a committee, were we referring to undocumented, or I would suggest that we write it as undocumented foreign nationals, if the committee agrees with me. Thank you very much, Chair.
Okay, Honorable Clark.
Chairperson, I've gone through this report and read all the issues and the recommendations. I was unfortunately not at the meeting on Thursday, but I have chatted to my colleague as well, and he agrees on a lot of the stuff. But I think it's necessary that issues that arise now must be added into the recommendations, going forward. Because in terms of foreign nationals, I think we need a joint conversation with international affairs, how we are going to be negotiating with SADC countries in terms of an MOU when foreign nationals are treated in our country, and how they're going to reimburse South Africa for the health care that they receive here. I think that's a very important point to look at. So for me, these things should be formed part of the recommendations. Thank you, Chair.
Okay. Okay, we'll then allow and see whether that is coming in. Honorable now, I will not take members one by one. I've opened up a space. Members, raise your hands if you want to add on. Dr. Letlape?
Thank you, Chair. I just wanted to speak to the issue of foreign nationals. I think it should be left generically as foreign nationals. Because even if you come in properly, but you come in here for health services, you still pose a strain to our resources because you're not budgeted for. So until we have further details, let's leave it broadly as foreign nationals, and hopefully from our centers, they can give us a breakdown of those foreign nationals, how many are documented, how many are not documented, how many are overstays, etc., etc. Thank you, Chair.
Okay. The point of Honorable somebody is coming through again.
No, Chair, just a brief one. Can we also issue a statement, especially in particular with regard to the foreign nationals, encouraging that all the Israeli people must not be treated in our hospitals?
No, that's against the Constitution.
We won't do that. Honorable Mutubase, let us actually go with what has come up here. I'm not aware, but we can include both what Honorable Mutubase and the strong point by Honorable Teko. The issue about that hospital was raised, that CAC was raised on our visit to Northwest, but there's nothing wrong to put it again here in our recommendations as a point of emphasis, even though it will still come up as in a separate report. I would actually argue we add that. The issue of foreign nationals, I would wish that we really put it the way we are saying, because whether documented or undocumented, they have an impact on our health facilities. In fact, I was actually sharing with you, some of the doctors have written in the neighboring country to say, thank you very much, Dr. Ramatuba. This patient is under treatment for cancer. We will continue with our treatment for cancer in our country, but please, can we just transfuse and bring back to our country? Now, that is clearly an official report. Now, we could also want to tackle that, was if we say only illegal, so what are we saying about doctors referring as if they are referring from Northern Cape to Gauteng? I mean, referring from a neighboring country. Look after this. So the fiscus is not taking care of that. So I think for now, because of the impact it has on health, we will leave it as foreign nationals getting into the fiscus of our health services. Thanks. Let's move on to that one of yourself, Honorable Mutubase. You must make a motion in another space, not here as part of our committee. We can't have such a conclusion as a committee of parliament when that matter has not found its space into a debate properly. Let's then get into recommendations, Ms. Mbali Makubane.
Thank you, Chair. Starting off with the National Department of Health, the department is encouraged to address all the Auditor General's findings in order to improve its audit outcomes, such as addressing irregular expenditure and consequence management. And this report should be presented to the committee. The department should present a report on how it's assisting the struggling provinces, the Eastern Cape, Northern Cape, and Free State, strengthening of financial control at both national and provincial level to reduce waste, all the expenditures, regular financial oversight and provincial supports are important. Enhance or improve oversight over the provincial departments on the issues raised by the Auditor General, which includes the ideal clinics, ideal hospitals, and infrastructure project management. Ensure that provincial departments reduce accruals by enforcing stricter budget controls. The permanent appointment of staff in health facilities should be attended to. Engage National Treasury on funding mechanisms for the entities that are constrained by budgets, such as OHSC, the Health Ombudsman, and the Mine and Works Compensation Fund. The TB treatment success rate should be improved upon by addressing the underlying challenges. The committee is also urged the department to address the concerns regarding the Gugulethu Clinic, and also encourage the Gauteng Department of Health to invest in capacity for oncology treatment. On entities, on the SMRC, the committee encourage the SMRC to continue upholding stringent financial controls and governance as shown in their audit outcomes. The fund should prioritize digitization of the records and introduce innovative ways to track and trace beneficiaries. The CMS should address irregular expenditure challenges and also prevent the reoccurrence. On SAPRA, staff grievances should be addressed, and also they should clarify its role on indigenous medicine, also address the backlogs. On the Health Ombudsman, it should improve on the utilization of digital technology to improve public awareness and also strengthen partnership with the academia in dealing with complex complaints that requires specialized knowledge. On the OHSC, the OHSC should develop a risk-based inspection strategy focusing on high-risk facilities in light of the limited resources. And that will be the end, Chairperson, of the recommendation. Thank you.
Thank you very much, Ms. Mbali. I will open up again for members. Honorable members add on, suggest, delete. That one, we take it that what members have actually said will come in, the CHC in Northwest will come in just around that space where also we are saying concerns raised with Kukuletu Clinic, that must also come in there, and together with our point that has been raised by members on the foreign nationals. Honorable Shabangu, may I recognize firstly the hands that would like to add on? So far I have one, that is Honorable Shabangu. If there's any other honorable member who would like to, let me then take them in this order. Honorable Shabangu, you'll be number 1, followed by Honorable Clark, number 2. Number 3 will be Honorable Keko, and 4 will be Honorable Motubate. The last hand so far is Honorable Dr. Letlape. In that order, thank you very much. Start, Honorable Shabangu.
Good morning, Chair. Good morning to everyone in the platform. Mine is just one, Chair. On the recommendations, most of them is critical issues, like your staff shortage and irregular expenditures. I don't know if we just say they must address staff shortage. I'm just taking that as an example. But generally, there are more issues that are critical on our recommendation. Is it not proper to say by when, or we can go on for 5 years that they are fixing the shortage of staff in the hospitals or clinics? It's just at one point that maybe time frame so that there is focus on by December next year, by next financial year, these things should be addressed. Thank you, Chair.
Okay, next one.
Thank you, Chairperson. Just in terms of the National Health Department, the one issue that was raised is that their spending pattern was very good, nearly 100%, yet their service delivery outcomes do not align with that spending pattern. And I think it's necessary that the department produce a report in line with their budgets, X amount of budget, these are our targets, and what we've been able to achieve from the budget and the targets, because that would give us a very good idea how their productivity will be going in the department. And then I think it's necessary that the provinces are called to the committee and they put forward their consequence management preventions and strategies and what they're going to do to improve in terms of also internal controls and oversight, and how they're going to be achieving their ideal clinics, as well as in terms of their cancer treatment and oncology. I don't know if you saw my questions that came through a few weeks ago. I mean, the provinces are really not doing well in terms of cancer treatment. Then in terms of digital vibes, I think we need the SIU to come and present that report to us. And then in terms of TB, I think, in terms of TB testing, the TB testing should actually go hand in hand with HIV testing as well. So I think it's a combination that needs to be looked at. And then I raised the issue that we need to have a joint conversation with international affairs as to how we're going to collaborate with SADC countries in terms of payment for foreign nationals in this country and their healthcare. And I know in terms of the Constitution, we need to treat every person in this country, but there must be some form of reimbursement in terms of the cost factor. And then we also spoke about, Chair, that you would approach the Minister and National Treasury in terms of the budget for the OHSC and how we could assist as a committee. Thank you. And then also, you know, I mean, I agree with all the recommendations and that were put forward, but I can be very, very pessimistic at times when there's no timeframes put in, because it's very easy not to achieve the recommendations if there's no timelines for recommendations. Thank you.
Yeah, no, before we move on, just to go back to Honorable Clark, if maybe you could expand your ideas. We can't leave it as is, just get provincial departments. There are 9 of them. Maybe there must be an area that these ones are targeted, because or maybe we bring them, all of them one time, and they talk about these issues that we have raised. But in the report here, there are challenges, mainly Free State, Northern Cape and Eastern Cape, with audit outcomes and all other issues. But the other ones related to unclaimed bodies is none of these. Oh yeah, is Eastern Cape, is KwaZulu-Natal, and another and then another one, Eastern Cape. But when it comes to other issues, again, it's related to that part. Now, again, I would wish to say probably expand. It's just not international affairs, even home affairs and any other portfolio committee we may have to engage about the undocumented or foreign nationals. So I wanted you to maybe come back later to expand on these issues rather than to leave, so that we can be able to guide the committee properly. Honorable Kheko.
Yes, sir, thank you very much. Let me first appreciate the manner in which the report has been drafted by our administration. At least it reflects, it has the true reflection of what was observed, discussed, observed, and recommended by the committee chair. Not far from what Honorable Clark has raised on the issue of the spending patterns versus the performance of the department, I think we need to frame a recommendation regarding that. I'm still thinking about it, how we'll put it, but we need to have a recommendation around that, because in every cent that has been spent, we must see value for money, Chair. Also, coming to the issue of medical legal claims, where we observed that there are more cases coming from the Eastern Cape, I think we must recommend something to the health ombuds, because it has been observed that most cases are not registered to that office. What is it that we can recommend? What is it that can assist the people of the Eastern Cape to, or make use of the service of the health ombuds? Must we recommend a campaign that can create awareness to the people of the Eastern Cape that they must make use of that office? I wanted to share those 2 views, Chairperson. Thank you.
Okay, thank you very much. Honorable Mutubatse.
No, thanks very much, Chair, and also welcome the report. One, on the question of the Gugulethu Clinic, I think the Deputy Minister did indicate that there is a report that talks to the project and the relocation of the Gugulethu Clinic itself. So we must actually emphasize that we must revisit that particular report and immediately act on the relocation of the clinic and find space where it can actually be upgraded. And that's what the Deputy Minister said. We must encourage that. And on the OHS, I think there was an issue that we raised around the standards and the readiness level of institutions vis-a-vis the NHI. And our recommendation was that perhaps, or the recommendation perhaps should be to get more funding to increase on capacity for OHS, and maybe perhaps suggest that they be in link with the health and welfare sector to see if they cannot train young people who can help with the identifying the readiness level of institutions vis-a-vis the IEC requirements. Thirdly is around the categorization of our decisions. I think falling back to what the other members were saying, that we need to say at this particular date, this is what we would have done. Maybe the immediate, the medium, and the long term. I think that will assist, but with clear dates. Also adding to that would be how the department will help with the accruals in the provinces, also at the national level, but come up with the clear dates that will say during this particular period, this is where we would have reached, so that in the coming year, we at least see progress registered. Thanks, Chair.
Yeah, thank you. Maybe in keeping with what Honorable Shabango said, we need to insert in our recommendations that we need to see a progressive improvement of staffing that will be reported to the program, to the portfolio committee regularly. Our regularly may be every 4 months or something like that, quarterly, to show a progressive improvement of staffing, as we actually want to see that. So maybe we need to see that from the department, insert that. Honorable Dr. Letlape.
Thank you, Chair. The issues that I want to raise, firstly, the one that Mr. Mutubaze has raised about health becoming a national competence, and that would require certain political decisions to be made, because we can't be discussing issues relating to NHI, having an NHI app, where you are basically making health a national competence without the requisite changes in the legislative framework. It does not mean all provinces are not working, but the provinces should be sites for service provision rather than policy making and political governance. In terms of the expenditure, where we're spending 99.6%, but we're performing at just under 60%, what we would need to see from the department is consequence management for non-delivery on targets, despite spending the money. It can't be business as usual. If you have people that are spending the money but are not delivering on the target set, that's non-performance, that's poor performance, and there needs to be consequence management. On the issue of foreigners, ethically you've got to treat, but there has to be a policy that says you treat after treating, you call home affairs, because every foreigner should pay for the services that are rendered to them. There should be no entitlement to free services for non-citizens. Even if you have emergency care, we need to cost recover for the emergency care. We need to make sure that we move from being hospice-centric to promotion of primary health care. From our recent oversight visit, the hospitals perform differently, but the sites where we need excellent performance in the clinics are not well supported. And we need to ensure that resources are redirected to clinics and community health centers in terms of funds and resources. We need to look at, when we talk about an ideal clinic, are we talking about, are we looking at pharmaceuticals? Do you have the drugs that you need? Do you have stockouts? Are we looking at staff? What we saw at Mokwase was heartbreaking, to have 2 primary health care nurses having to see nearly 300 patients a day. Are waiting times part of what is factored in an ideal clinic? It can't just be about infrastructure. It has to be about services as well. So we need to have a discussion with the OHSC that the matrix fundamentally has to be about also being able to measure the service to patients, because that is the key deliverable in healthcare. Thank you, Chair.
Okay, honorable members, with all that being added on, we would like to then ask the team, is that a new hand or a second bite, Honorable Keko? First hand, a legacy hand. Yeah, we would like then to request our team to amend accordingly as put by the members, and then that would then form our report, which we will need to adopt with the recommendations that have been inserted by the members here. May I therefore request that with all that being said, inserted, done, brought to us later, we will then say this is our report of this portfolio committee of the BRRR. May I therefore call for the adoption of this report by these members with the amendments that are going to be inserted there. Honorable Van Staden.
Thank you, Chairperson. Chairperson, the Freedom Front Plus reserves its right to take the BRRR report to our caucus for a final decision. Thank you.
Thank you. Honorable Keko.
Yes, Chair. Thank you very much for the opportunity. I raise my hand to support the report, that the report be the report of the committee on the BRRR. It's fully supported, Chair. Thank you.
Thank you very much, Honorable.
With the recommendation, with the additions that we've made, Chair, with the additions made. Thank you.
Thank you for calling in for the adoption of the report with the recommendations that have been added on from this meeting. Any seconder? Honorable Shabangu.
Thank you, Comrade, Honorable Chair. Rise to support the adoption of the report with the added recommendation. Thank you.
Okay, thank you very much. Were you going to say the same thing, Honorable Clark?
Yes, Chairperson, I concur. Don't fall off your chair now, Chairperson. Thank you.
Say that again.
I said we support with the added recommendations. I was just going to tell you, don't fall off your chair now. We're supporting the report with the added recommendations.
Thank you very much, honorable members. We will then be getting the department to join us at 10, but there is another item here on the minutes. I can't remember which meeting is that. The staff will show us that we need to look into the minutes. Ms. Machalamba, is it one meeting or 2 minutes or 2 meetings? Show us then we can go through that. There's a legacy hand or the new hand, Dr. Letlape.
I also just wanted to support, but we should not forget to express our extreme concern about budget cuts for the essential service.
To be inserted. Thank you very much. Ms. Machalamba, can you show us what is there as the minutes of the meetings we have had in the past? Save for these ones, we are not going to adopt these minutes of today, but the past ones, which ones are outstanding? Okay. Honorable members, this is, so it means we are going to go through the minutes of what we have just adopted individually now, that on the 15th of October, just check your names, presence. We had these briefings from Financial and Fiscal Commission, the next one was the Auditor General, and then the third one was the South African Medical Research, ending with the Mines and Workers' Compensation. These are your names that were there. Just check your name that you were, okay, and then move on. So what we have just adopted is reflected here on a day by day. What is more important that, honorable members, you participated into this meeting, and the discussions that we have just wrapped up now is individually taken care of here. Thanks. if there are any member who want to adopt, call for adoption of the minutes of the 15th.
No, Chair.
Yes, Honorable Van Staden.
No, it's Mutubat. I didn't see my name there.
Let's go up again. Maybe you didn't, maybe you disappeared. Let's just check what happened. Were you there, Honorable Mutubase? Yes, you didn't see your name.
Yeah, this medication is.
Okay.
It
I must change doctors, eh? Must just change doctors, give you a better medication. So, honorable members, you were all indicated to be either present or absent there as reflected, and these minutes are therefore called upon to be adopted of the discussion that took place on the 15th of October. Any member who wants to call for adoption?
I do, Xhego. I call for adoption.
Honorable Xhego, thank you very much. Any seconder, Honorable Sinne?
Thank you, Chairperson. Fine. Thank you.
Thank you very much. The minutes are therefore duly adopted. The next day, we had another presentation, we had a presentation on the 16th of October of the other entities. I can't remember starting with one. Okay. The minutes will be shown right immediately. 16th of October, we then had the Council for Medical Schemes presentation, followed by SAPRA. The third presentation was Office of Health Ombuds, and the last was Office of the Health Standard Compliance. Can we reflect and show which members were present? Honorable Mutubase was again present, and he's reflected there. And this time around, Honorable Dr. Letape joined us. He was also present. So in this meeting, honorable members, these presentations were made and the recommendations were made, and then those have now been collated into a bigger picture of what we have just adopted. So again, I would like to call for members to officially adopt these minutes. Any honorable member? I can't see you just
Honorable Shabangu, I rise to propose the adoption of this meeting. Thanks.
Honorable
Minutes.
Shabangu calls for the proposal to adopt the minutes. Honorable Clark?
Chairperson, I don't see that I'm present at that meeting. I wasn't present on the Thursday night meeting, but I was present at all the other meetings.
Can check if you are there. We'll also look and ask your doctor to check the medication. Let's go back and see the attendance. Okay. Yes.
There I am. Sorry.
Go and ask your doctor to change the medication, Honorable
No,
Clark.
Chairperson, I'm tired. I've been studying very hard till late at night.
You were there in this meeting, and therefore you are calling on us to second the recommendation to adopt this.
Thank you.
Okay, so honorable members, the minutes of the 16th of October are duly seconded, has been adopted. Then move to I think the last set, that is the meeting that Honorable Clark did not attend, and she volunteered to remind us that she did not attend the evening of the 17th. Okay. Honorable members, here we were just getting the department to respond and to present and respond to issues raised by the entities. And then that's where Honorable Clark had apologized. All other members were there, including Honorable Mutubase, so your name is there. This was a meeting that actually went on to get a presentation of the department together with their responses to the entities and issues that have been raised. All that, again, honorable members, has then been collated now into a bigger report that we have just adopted. May I therefore call for honorable members to adopt this report of the presentation done on the 17th of October by raising hands or show or shout. There's a hand that remains on the platform. I don't know if there's a new hand. Honorable Sinne.
It's a new hand, Chair. I want to propose the adoption of these minutes, but Can my initials be corrected, Chair? I've been requesting for my initials to be corrected. I am Sinne MM, not SM. Thank you, Chair.
Okay, Honorable Mbali, you must drink coffee before you write the names of members. It will just get this. And the third correction that she's asking. Honorable Motubatsi?
No, thanks, Chair. I'm happy practice makes it perfect. You can now pronounce my surname. I second.
You know, people who are Zulu speaking have a very strong tongue. I mean, Honorable Keko will agree with me. I'm struggling, but I'm getting there. Thank you very much for giving me a commendation that I'm doing well. So these minutes of the 7th of October have since been duly adopted and seconded. Thank you very much. Ms. Machalamba, is there any other fourth set of minutes? I doubt.
No, Chair. No,
Okay.
Chair.
Honorable members, you've done very well up to now. The department is joining us at 10 o'clock. Grab a cup of coffee, tea. Please, I'm going to be watching those members who think this is a smoke break. There's no smoke break here, please. We will be back at 10 o'clock. Thank you very much.
There's one culprit, my friend,
No,
Honorable Van Staden.
No.
No, I'm in
Yeah.
transit at this moment, so I can't.
Let's reconvene. Let's reconvene, members. I'll give you an allowance at least 3 minutes after 10. We will then start. Thank you very much.
Thank you, Chair.
Okay, good morning once more, honorable members. Just wrap up your Deputy Minister, we have had our meeting from 9. So I ask the members to just come back with their coffee tea at 5:10. So we just have another 3 minutes. I would then welcome you with your team. Then we could start with yourself. And thank you very much. Okay. Once more, good morning to all of you members, our staff, and the Deputy Minister and the delegation. We have invited you here, Deputy Minister, and I note that I did, honorable members, get a meeting. I met the minister in the sitting yesterday, and he did brief me that the delegation be led by the Deputy Minister because of a presentation he has to make to Cabinet today. So I accepted that and said I will report to the Portfolio Committee. We are bringing the department again on this tobacco bill and electronic products because we will be shortly starting with the public hearings. Now, we needed to just make sure we have a full understanding of this bill. I've since written to you, honorable members, in our group to say, rather than they start the same presentation again, we start with ourselves on the issues that we would want to understand much more broadly and deepen our understanding on them. So it would be the members first raising issues, and then they come in to emphasize on those points. But prior to that, honorable members, I have requested the Deputy Minister to lead and present to us this issue that comes so often from members regarding NEDLAC and this bill. And I can recall, honorable members, that there was a time when, at the time I was not in this committee, Dr. Kenny Jacobs, our former chair, phoned me and requested explanation on this matter. And I said, no, NEDLAC cannot write to you in that state, in that arm of the state, which is legislature. The NEDLAC interacts with the department. And nevertheless, this matter then went on, and members here, some of them in this platform, went on the public hearings. We are left with 2 provinces to do, and then one in other provinces. But this matter is coming up again from our honorable members. Some of the honorable members who have done public hearings, they said, look, what about NEDLAC again? So that this matter of NEDLAC and the department and us would then be put to rest, I've requested the minister, Deputy Minister, to start explaining to us what were the processes that happened prior to bringing the bill to Parliament between the department and NEDLAC and all those issues. And that would be very helpful before we engage with you, Deputy Minister, can you really take us through that process and make sure, because we do not have and we do not really interact unless NEDLAC has written to the department, through the portfolio of which Ms. Machalamba still has to appraise me, how many institutions have written requesting to present, and NEDLAC will be welcomed to make their presentation at that time, but they do not actually stop processes of public hearings because there are issues that must be sorted out. Please give us an indication how well we have attended to those requests that have been coming in from NEDLAC. By the way, NEDLAC has not really written, at least now that I'm the chair of the portfolio committee, raised those issues with me. But there are members in this portfolio committee who are well versed with discussions that have taken place between NEDLAC and themselves, and they have brought those discussions into this committee. And therefore, officially, Deputy Minister, take us through that process. What has been the process before you brought this discussion to the Parliament?
Thank you very much, Honorable Chair, honorable members of the Portfolio Committee. Indeed, Honorable Chair has raised this matter with myself on behalf of the team led by the Minister. So we have looked at it again to just recap the process which we have followed in the 6th administration as this bill was being processed and finally submitted to the National Assembly, to Parliament. Can I, just to make it easy to follow, if I'm going to ask Ms. Jeanette Hunter, the DDG in the Department of Health, to give us a very short chronological presentation in terms of what happened in this regard. Ms. Hunter, can you please flight your report and proceed?
Good morning, Honorable Chairperson, honorable members. Thank you, Deputy Minister. Chairperson, this is a report on the engagement between the National Department of Health and the National Economic Development and Labour Council, commonly known as NEDLAC, on the Tobacco Products and Electronics Delivery Systems Control Bill. And it's our pleasure to present this to the Portfolio Committee on Health today. And so the purpose speaks to that, Chairperson, the fact that we want to report to you the process that we followed in engaging NEDLAC. So in terms of background, Honorable Chair, on 9 May 2018, the Minister of Health published the bill for public comments, having obtained Cabinet approval to do so. The process of considering comments and making amendments based on written public comments and consultations ended in July 2022. The stakeholder consultations included the tobacco industry, relevant government sectors, and civil society. Honorable Chair and honorable members, the National Department of Health had 2 consultation sessions with NEDLAC. In terms of the relevant provisions of the NEDLAC Act, sections 5(1), C and D, the department fully complied with the consultative requirements of the NEDLAC Act. Section 5 of the Act provides as follows. The 2 areas of Section 5 that are relevant to us as a department as C and D, and we quote them here, Honorable Chair. C says, consider all proposed labour legislation relating to labour market policy before it is introduced in Parliament. And we want to highlight that this particular bill does not deal with labour legislation, but in any case, we did engage in NEDLAC on D, which then speaks to changes to social and economic policy before it is implemented or introduced in Parliament. And Chairperson, I'd just like to draw the committee's attention to the fact that the NEDLAC Act speaks about consider, that NEDLAC must consider and like any other role players and stakeholders provide their comments. So the bill was first presented by the department to NEDLAC on 20 October 2021 in a virtual meeting. At this meeting, the chairperson of the meeting allowed all participants to ask questions and make comments. The business representatives did not ask any questions, but instead requested the formation of a task team to discuss the amendments of the bill clause by clause. It was our expectation as the department that NEDLAC would do this and submit their comments. In line with cabinet processes, the bill was presented at the meetings of the following government structures. We took the bill to the Social Protection and Community Human Development Cluster Technical Working Group on 22 March 2022. We took it to the Social Protection and Community Human Development Cluster on 13 April 2022. And we took it to the Forum of South African Directors General on 1 August 2022. Cabinet approved this bill on 21 September 2022 for submission to Parliament, and this is the bill that is now before this committee, Chairperson. So, Chairperson, despite those processes that we were going through, we had a second meeting with NEDLAC on 28 July 2022. This meeting was facilitated by the Department of Trade, Industry and Competition. And at this meeting, the Department of Health was again informed that NEDLAC wants to do a clause-by-clause discussion of the bill, and it was our expectation that they would do so and provide us with comments. Chairperson, in conclusion, we want the committee to note that NEDLAC was consulted twice by us as a department. And we want to point out to the committee that in light of the first meeting with NEDLAC having taken place on 20 October 2021, and the second meeting on 28 July 2022, and that the NDOH only took the bill to Cabinet on 21 September 2022, NEDLAC has had sufficient time to provide comments on the bill in line with the provisions of its own act. Thank you, Chairperson. I end there, Chairperson.
Yeah. Honorable members, I was tasked by Deputy Minister Pasha, at the time was a minister, to come and brief Parliament on this bill. And that is the reason why, when you were ready to start the public hearings, and there was an issue, and therefore the former chair, Dr. Kenny, phoned me to say, what do we do now? There's this and that. And actually what Ms. Hunter has just brought in is what we actually brought. Before that discussion, to say, before Parliament, there are processes that happened. NEDLAC is but one of those that are consulted. So it can't be that when the bill is in Parliament, we then get what we are getting. And therefore, that has to be addressed. So it's an issue that has been well taken care of by the department. And I thought they should just bring this matter before we can discuss this matter. So I want members, firstly, to acknowledge that there has been an engagement between NEDLAC and the department. That engagement happened twice, which is usual once, and that happened before it came to Parliament. So there's nothing that stops NEDLAC to engage with Parliament at the time we come and request those submissions to be discussed. But it can't be that there would be. So I was finding it a bit disheartening that in the 6th Parliament, there has been a public hearings on 7 provinces out of 9. If this portfolio committee of the 6th administration had all the time, they would have finished the public hearings. We are just completing, which is again another matter raised by a member, that do we start all over again? Probably when I raised this with the House Chair, there's no justification. We continue from where they left off. Now, it's actually then as a challenge to then, when we are getting this second briefing, deepening our understanding of the bill, to take it to the public. There are still concerns. Have you consulted NEDLAC? Have you engaged with NEDLAC? We can't. The department now has answered that they have done so, and I would hope that this matter then is done and dusted and we can move on. But nevertheless, let's open up for members to comment before we get to engage the department. This now is evidence. It's not like an opinion is a fact that there has been a consultation network, and that is why Honorable Dr. Jacobs, former chair, was able to lead a portfolio committee to do public hearings and get done with that. Now I notice 3 hands in this order: Honorable Shabangu, Honorable Van Staden, Honorable Clark, Honorable Dr. Letlape, Honorable Sinne, Honorable Kumalo.
And Chair, I'm to raise hand now.
In that order,
Yes.
start Honorable Shabangu, number 1, Honorable Van Staden, number 2, Honorable Clark, number 3, Honorable Dr. Letlape, number 4, Honorable Sene, number 5, Honorable Kumar, number 6, Honorable Kweko, number 7, Honorable Zungula, number 8, Honorable Mutubatsi, number 9. Okay, all members are participating on this one. The hot potato now, okay? Thank you very much. Start, honorable members, with the numbers given to you.
Thank you, Honorable Chair. And we really appreciate that the department was willing to bring back and also inform us on the discussion that has taken place between the department and the NETLE. And having said that there were public hearings in the 7 provinces, previous administration, that 7 provinces, the public hearing took place. Now we are left with 2. And to find out that where we are now, we are playing back and forth with this network thing instead of finishing our work. For me, Chair, this shows a conflict of interest from the members of this committee, because there is network and there's us here. And if we do this, we are derailing the work of the portfolio committee, and also we are not assisting the department. We're supposed to do our work, do this public outreach, but we are playing back and forth because of conflict of interest. If it's not in our jurisdiction, let's leave network with the department and continue with our work. We can't be playing back and forth. We've got teenagers, we've got kids. Because of this, the bill that we're talking about, regulation of the tobacco, our kids, they are exposed to these vapors and they end up in drugs. We are not talking the hearsay, it's happening with our kids because of all what we are talking about in this bill, that it must be regulated. It's a known fact that teenagers, they are in the gigs, whatever, and this thing is everywhere and it leads to a lot of problems. So I'm just saying, Honorable Chair, that as members of this portfolio committee, we must stop this thing of having conflict of interest, because we are actually derailing the work of this committee and also are not assisting the public. We must weigh the effects or the between the business and what is this thing doing in our communities. We can't be playing this game of derailing this. Actually, there is no reason, because we've already started. We need to finish this. It's all that I wanted to say, Honorable Chair, that for me it's disheartening, like you say, because I've got teenagers that have been through this thing that we want to regulate. And honestly, let me pause there.
Honorable Van Staden, thank you.
Morning, Chair, morning, members. Thank you. My apologies for not using my video. No, there's no conflict of interest here, and there's no derailing of this process. My concern about this thing is the following. We had a committee before this committee, the department before this committee on the 4th of September. And we deliberated on this matter, and some of our members put our views in the meeting. But what worries me was on the 6th of September that NETLAC issued a statement in the press to say that the Department of Health has undermined them after allegedly snubbing the council before tabling its new proposed smoking and vaping bill at Parliament. And according to Netlac, they claimed that there had been no consultation on the bill and therefore demanding that the department alter a parliamentary process. Now, when I read this article on the 6th of September, it was very disturbing for me to read it as the department told the committee on the 4th of September. And they've told us again today that they had consulted with both business and labor. And according to Netlac, the department only gave presentations about the bill and did not allow its parties to present their views. And in light of these developments, Chairperson, I also sent a letter to you on the 20th of September to raise my concerns regarding this matter and to state to you that we simply cannot continue with any further processes until the matter with Netlac has been resolved. Otherwise, we will open ourselves up for huge legal battles that we will have as Parliament on our hands if we are going to continue. And I must put it under the committee's attention as well. But it came under my attention that Business Unity South Africa sent also a letter yesterday to Parliament, and also on the 3rd of September, and also on the 4th of July last year, to raise the same concern in this matter. Now, if there were a meeting with Netlac where they were consulted properly, as the department is saying, then I would say that we need a report about that matter because, Chairperson, I'm really serious about this. I'm not derailing anything. I have a big concern that if we're going to continue with a process that is not handled in the correct manner, we will sit with huge legal battles on our hands. And who's going to take the fall for that? This committee is going to take the fall for that. So we must handle this matter with care and according to the law. Chairperson, that's all for now on this matter. Thank you.
Okay, Honorable Clerk.
Thank you, Chairperson. Well, Member van Staden has covered a lot in terms of what I wanted to say. And you know, we did discuss this in the last committee when the tobacco bill came to the committee, and we weren't informed in terms of this presentation that was given to us today. So you know, last time I checked, we do live in a democracy, and it is the right of these committee members to raise issues. We're not derailing the process. We just want it to follow in the right process, and maybe there should be a recommendation that Netlac actually come and present to the committee so that we can interact with them and be satisfied in terms of their input in terms of this bill. Then there's just a few other things I would like to raise, and that is in terms of the stakeholders' presentations. So when we did the NHI bill, stakeholders were afforded to come to the committee to present, and I think we must allow that very same process to happen. Yeah, I just want to. Then also, I'm very interested to know what the financial impact was in terms of the study that determined the stricter regulations, and if we could just get that and what impact that has in terms of the fiscus. And
Honorable Clerk, you will get a space to deal with the meat of the bill. Let's start this for now.
Okay, great. Okay, and then Chairperson, just on one more issue, we need to get community safety SAPS to come and have a joint committee meeting with us to talk about the illicit trade, because it's a huge concern. Thank you, Chair.
Honorable Clerk, just to remind you and all the honorable members, I was chairing that meeting. The Deputy Minister did say what they've presented, but he did not have it written down. I've insisted that Honorable Minister, Deputy Minister, please bring it to us in writing, which they've done, and I've requested them to convert this into a letter. So Deputy Minister did raise it in the meeting when they presented that they've consulted with Netlac. Probably we chose not to remember that he said it, but I was chairing that meeting. He did mention that. Honorable Dr. Litlap.
Thank you, Chair. From the explanation that has been given by the department, I sense that the department and Netlac don't hear each other. Because what happened in the first meeting was a request for clause-by-clause interaction. and that was repeated in the next meeting. But Ms. Hunter clearly states that she expected, or the department expected, that NEDLAC will do it on their own. And I think that's where the communication fell down. The other side may have been expecting that there would be a meeting scheduled to go through this thing clause by clause. And that's the gap that is there. So I would respectfully request that between NEDLAC and the department, they sort out their issues so that there's full consultation. And I think that's where they missed each other. So either the clear communication goes from the department to say, we are giving you the space to interact with the bill clause by clause, and we're expecting those inputs from you by a set date. Or here's a meeting if you're expecting a bilateral clause by clause engagement. So whatever the issue is, it needs to be clarified between NEDLAC and the department and concluded. So they've met, but from their meetings, they left on a pause where there was an agreement or a tacit agreement about clause by clause proposal from NEDLAC, but no engagement about how, who, and how it is going to be concluded. And that is the missing link. And that will go into the issue where people say we're not heard. So for me, Chair, I see a gap in how NEDLAC and the department interacted because they never completed their business between themselves. Assumptions were made and no action was taken on what was put on the table. Thank you, Chair.
Just to add on that, to Haletape, if I will still have to check with Ms. Machalamba, if NEDLAC is one of those that Honorable Clark is talking about who might have submitted their request to make submissions and talk to us, they are free to do so. They will be given a slot at the right time by this boss. When we finish, honorable members, we will have to listen to all those who have written to say, no, I'm in a public hearing, but I still want to come and address. That's how we will do it. There will be those, and maybe NEDLAC is one of them, who will then have their own space to interact with the department, with the portfolio committee and make their submissions as would give them any other person any right to do so. Honorable Sinne.
Thank you, Chairperson. Chair, I want to align myself with Honorable Shabangu because based on the presentation by the department, I think it clarifies most of the concerns in relation to NEDLAC because it was consulted according to the presentation by the department. And my other point, Chair, is that public participation was done already in 7 provinces. Why can't we continue to complete the 2 while these other processes of department meeting again with NEDLAC are taking place? I don't think we should stop the public participation because of NEDLAC. Thanks, Chair.
Thank you. Honorable Kumalo.
Thank you very much, Chairperson. Greetings to your good self and other members of the committee. Chair, I think we've listened to the presentation from the department in relation to the meeting that they've held with NEDLAC. So, Chair, we must not forget that this bill is trying to stop other people from doing wrong things. So people will not allow it. So I will agree with Honorable Sene to say, let us continue with the consultations. If NEDLAC wants to be consulted again, I think the committee must give them time or rather a slot to listen to what is their input in relation to this bill. But NEDLAC is not the only stakeholder in relation to this. Our communities are stakeholders also in relation to this bill. So we must continue consult our communities. Then NEDLAC as a stakeholder also will be listened for the second time or for the third time. Thank you, Chair.
Thank you. Honorable Kayako.
Thank you very much, Chairperson. I also thank the department for bringing that clarity. I am that person, Chairperson, who respects views of other members. But in this case, there is nothing before us as a portfolio committee that stops us from processing this bill. Remember, Chair, any communication that is official will go to our committee secretary, then yourself, then it comes to us. If there is a concern from NEDLEC, we will meet them when time is right. Believe you me, Chair, the bill has, when the processing of the bill has got stages, time will come for NEDLEC, but I would advise people that are close to NEDLEC, like the National Department of Health, to continue their engagement outside the arrangement of Parliament. Remember, we are following a program that we have adopted. I am a member of the National Assembly in the 7th administration, but through the legacy report and through the presentations of the department, I now understand the importance of this bill. This bill is talking to those that would use their last cent, those that are addicted to tobacco, those that are less fortunate, that would use their last cent instead of buying bread for their children, they would buy a packet of cigarette. I'm talking for those who are suffering from diseases like tuberculosis, and they do not understand the dangers of using excessive use of tobacco. I'm speaking for those. Chairperson, I think NEDLEC must do its duty. It must consult the department. If there are any issues to raise, they must raise those issues outside this arrangement. But I would advise that we publicize, we invite interested stakeholders who would like to make presentation to indicate that, and that time be allocated. I recommend that we continue with our public engagements as planned. Thank you very much, Chair.
Okay, I would like to check that with the Secretary, whether now that we have reopened the bill again, we can top up and add on people who would like to make presentations. Maybe it is a fair comment to say in a new administration, there might have been people who have a second thought. They submitted their request, hoping that they would have been attended to. But now that we have reopened it, maybe there would be new members, new institutions. Ms. Majalamba will check and maybe confirm that what I'm saying may be true. Honorable Zungula.
Morning, Chairperson. Greetings to yourself, the honorable members, the department and the support staff, and everyone that has joined in. Chair, I think we just need to emphasize that we're dealing with a legislative process, which is a process that is directed by law as to how it should operate or how it should be processed. It is not a matter of it being optional, or maybe because of what the bill envisages, we think that perhaps let us, push through with the bill because of we want the bill to go through for good reasons, of course. But I think we need to emphasize that we need to do the right things as the law or the legislative process requires of us. I can remind you, Chair, that there was a time whereby there was a ban on tobacco and the industry went to court and that ban was declared unconstitutional, meaning here we're dealing with an industry that is not shy when it comes to taking this particular process now to court. That is why, Chair, it becomes very important that if we follow the processes in accordance to how bills are set up in Parliament, we won't have issues. And the question of NEDLAC, Chair, it is not a matter of people or the members who are asking questions trying to derail the process, but the request is to just say, let us do the right thing. Perhaps let me start by saying, Chair, when we talk about NEDLAC, it is a creation of Parliament. And because it is a creation of Parliament, we cannot just be reduced to be like any other stakeholder, because NEDLAC exists through an act of Parliament. Therefore, it needs to be given the space as through that act to play the role that is there through that act. Therefore, in that regard, Chair, I think it's very important that we need to state what does the act say when it comes to the issue of bills that are before Parliament. Firstly, Chair, is that NEDLAC does a clause-by-clause review, and there must be a NEDLAC report which outlines the areas of agreement, and this must be done through a formulation of a task team. This is properly recorded or articulated in the Act as well. Therefore, the department, in my view, or when I'm hearing the department, presented to NEDLAC, and there was no clause review. And therefore, it is in that regard, Chair, whereby we need maybe to read clause 7 of the process, because clause 7 of the process of NEDLAC, which defines what actually is a consultation. Clause 7.2, 6 and 7. 7.2.4, let me start there. It says NEDLAC is required in terms of section 5.1.d of the NEDLAC Act to consider any significant changes to social and economic policy before it is implemented or introduced to Parliament. If I can stop here a bit, Chair. So I want to come on and say, if the previous Parliament or the committee may have missed some of these steps or some of these processes, it is our moral and ethical duty as this particular, the 7th Parliament Committee, to correct all of those things instead of continuing because the other committee before us, they did it. Because it would be reckless of us if information comes to us, and as a committee, we know that some of these clauses were not followed when it comes to the consultation between the department and NEDLAC. For us to just say, let us continue, it means, Chair, we are being reckless. And again, we're undermining Parliament, because when you undermine NEDLAC, you are basically undermining the rules of Parliament, undermining Parliament itself, because NEDLAC does not exist on its own. It is through a creation of an Act of Parliament. And I was fortunate, Chair, to be in a portfolio committee meeting of Employment and Labour, where NEDLAC again was reporting. And part of the statements that were made by the executive director was to say that in their view, they as NEDLAC have not been consulted by the department on this particular tobacco bill. Therefore, Chair, it cannot be that there's an issue that is before us whereby a formal legislative process, which is not something that is optional to us, but it is an act of law, it's an act that directs what process must be followed when it comes to processing bills in Parliament. When we hear that there is something that is amiss, we need to take a pause, Chair, and say, how then do we make sure that we do things the right way, so that when we continue with the process, we don't have a process that is flawed, that would open the people to taking Parliament to court. There is a recent judgment on Mogale, a Mogale judgment that speaks again to the questions of what is consultation, public consultation? So meaning there is interest from people to take Parliament to court. So, Chair, the bill with the good intentions that it has, but the only thing that we're asking for, can we do things the right way? So my proposal is as follows, Chair. That number one, let us get NEDLAC as an entity that is born through an act of parliament to come to this committee to speak specifically about what transpired between themselves as NEDLAC and the department. We can't be reckless, Chair, to say if the department says A and B happened, and then we say, but we are going to believe the department and we are going to disregard NEDLAC. If the department is saying A, B, and C, but NEDLAC is saying X, Y, and Z, our duty, Chair, is to also get NEDLAC here so that we critically again ask them questions. All members here can hold NEDLAC accountable to say, but how come you saying you have not been consulted if 1, 2, 3 did not happen? And then from there, Chair, once this impasse between the department and NEDLAC has been rectified, it is only, and we know that the committee, whether it is a 6th Parliament's committee or the 7th Parliament committee, once we are satisfied that there is no part of the process that has been undermined or that would fail if whereby the committee would fail if it would be subjected to legal scrutiny, then we proceed with the process. But to proceed with the process whereby there is NEDLAC that is saying something is amiss, I think, Chair, would be grossly, undermining the very essence of Parliament. I want to stop there, Chair, on the question of NEDLAC. Thank you.
Yeah, honourable members, I want to confirm, as I'm calling the last member, Honourable Mutubas, that these are legacy hands. Honourable Van Staden and Honourable Dr. Letlape, your hands are up again.
There's a new man, Chair, but let's finish with the speaker before me, please.
Honourable Mutubas. Honourable Mutubata Pet.
Oh, sorry, Chair. I'm here. I actually wanted to follow your directive that we raise questions with the department, but now that the debate is actually on the table regarding NEDLAC.
Yeah, we will come to that as a second part after we wrap this one up.
Yeah, let's wrap this one up. Look, Chair, NEDLAC by its nature was established by Parliament. That's first and foremost. And by its nature, it is the biggest constituency that has got the ability and the capacity to can rally different formations in terms of business, in terms of labor and social entities to can arrive at a consensus. And it is this particular institution that has got the capacity to can communicate to millions in this country and outside in an organized form, either positive or negative, to our equal as Parliament, because this is our institution. They can do that even better than us going into the public hearings. Because in those public hearings, the very same people who are in those public hearings might actually be represented, will actually be represented in NEDLAC. And therefore, to be temperamental and be emotional and to dismiss NEDLAC would be the biggest mistake. Because it will cause no harm. It will cause no harm at all. If it was going to cause any harm, if we are to invite NEDLAC and all those stakeholders and say, because that's part of what we must do in terms of the Act, and say, look, this is where we are. you have consulted with your people in terms of business, in terms of labor. Therefore, what are they saying? And they go, and we have an agreement. We have the support of NETLEC. In my view, we have the support of the biggest constituency that we can ever think of. Unlike being temperamental, ignoring this whole process, and going into the public hearings and say, no, we don't actually care. It will be the biggest mistake. And therefore, I would actually request that this committee be patient, invite NETLEC, go through that process. Sometimes it is important to listen to things that you don't want to hear. And it is on those bases that I request that we give ourselves time, invite NETLEC, go through that process without being emotional. And then we'll come back and then we'll say, when we have arrived at a conclusion and we are convinced ourselves in the 7th Parliament to say that, no, look, we have reached this point, we have consulted, we are not in a bargaining forum, then we'll reach that conclusion. So, Chair, I'm actually canvassing that we be given that opportunity and we'll give NETLEC an honest answer when we have reached that level. Thanks.
Yeah. Honorable members, we will not open again for these 3 hands. Otherwise,
Chair.
we'll start again with the other hands. We will not, Honorable Van Staden.
Chairperson, please. I think we must clarify this matter. We need to have a second take on this and that we can resolve this issue. We cannot go.
Hold on before we get the department to comment. You raised issues. So we have not, I have not given my comments. So hold on. If you want the second round, you will, including Dr. Lechape. But
Okay,
every
thank you.
other member will also get an opportunity to raise if they so wish. Let us not rush it. Let us get everybody. The department has not even responded on the things that you have said if they wish to. So why don't you hold your horses until we have gone through that part? Or it's so urgent that you want to raise it now?
No, it's according to what we have said now, but I will wait that the department finish and then can have a second round, Chair. No problem.
All right. Okay. There are certain things that also have been said. I'm now making my own input to say, I don't know why some members overlook this process that says, that was read by Ms. Janet Hunter before Parliament. Did we see that? Now, they're coming in. So it means that is why maybe there's a notion that comes from some of the members that say, let's restart all 7 other provinces because they think that the work that was done was not, it must be nullified because again, among other things, is probably to accommodate this. What do you say about the work that has been done? Because there's a lot of, some of the people who believe that that work was paid for, done for, and there's no coming back. And I just teased that with the House Chair. There's no going back to the provinces that have had public hearings to redo because we think that was an illegal or an unconstitutional process. That's the first part. Because in that space, Honorable Zungula, it tells us that before Parliament is consulted, and there are members here who are saying, Department of Health, continue engaging, sort out the issues with yourself and the department on this matter. Number 2, honorable members, all what you are discussing here, it's almost what we read in newspapers. I have not, as the chairperson of this committee, received any letter from NETLEC requesting this, that they want to make a presentation. And if they do, would have actually given them a slot wherever. Now, the members are saying, when an other institution asks to really make a presentation, we must hold on and not give. There's a space that will be allocated, and I would hope that Mr. Machalamba will come in here. If NETLEC and any other person has requested to make presentation to Portfolio Committee of Health in Parliament on this matter or any other matter, they will not be stopped. But here you are saying, let us, on the basis of hearsay and things that you have read in newspapers, without any letter coming in from NETLEC, halt the process. We must write to them. I mean, what would be the rationale of that to say, no, we hear that they're unhappy there. There's a baby on the corner of the house who's unhappy. Please stop the whole process and go and check there. We could do so if we wish, but what is actually saying to us, that they have not written and requested. They've talked to the department. They continue to engage the department because they know that the processes of engagement legislatively, Honorable Zungula, is not with the Parliament unless they come and make a presentation like any other person. But here we are saying, no, halt the process, get them to come in, especially that they listen to. Yes, we could, but what is the timeline? Why should it be before or after? What actually informs us that it must be tomorrow and not next month? Department of Health, can you come back to us on this? And there are members who would like to, and I will note two hands, Dr. Letlape and Dr. and Honorable Van Staden. Minister, Deputy Minister.
Well, thank you very much, Chair. Chair, let me just start with, because I think the gist of the matter comes back to what Honorable Zungula said, and I think other members emphasized the fact that NEDLAC operates on the basis of law, and that all of us, the Department of Health and yourselves as the National Assembly, we all are guided by law. We did, and that's specifically why in the report we also just reflected on what the NEDLAC Act actually says. Now, I just want to maybe make, unfortunately, I think Honorable Zungula made the suggestion, or as if actually the NEDLAC Act prescribes that there has to be a clause by clause discussion with whichever department which presents a policy change to NEDLAC. Now, as we reflected on the relevant section, which is section 5C, section 5, subsection C of that, it relates to labor law, which must be considered by NEDLAC before it can go to Parliament. But on social and economic policy, it says the NEDLAC shall consider all significant changes to social and economic policy before it is implemented or before it's introduced to Parliament. And there is no way where, as you know, the members were emphasizing on the issues of following law, there is nowhere where the issue of, if whether it's not precluded, but it's not prescribed. So, as the report indicated, at the time when the department was interacting, there was a desire from the NEDLAC to engage clause by clause. There was no sort of objection from the department to say, no, don't do it. So it's not prescribed. They were but the business, the business part of business section within NEDLAC indicated that desire, and they were well within their right to can do the clause by clause, and subsequently, before the bill was approved by cabinet, and make particular comments in that regard, which were not done. So, but I think the emphasis here, which I want to make, is that to look at it as if, in terms, that's why we say that in terms of following the law, as the members are saying, that was done. The presentation was made. Some of the sectors in NEDLAC raised questions and comments, and one section then came with this proposal, which they were well within their right to can go through that clause by clause, which is definitely not prescribed. I was waiting for the honourable member referring to Section 7 of the Act to hear. To hear where, because the Section 7 has nothing to do with the clause by clause. It doesn't. So the Act itself, in no way does it actually prescribe, except to say that the Council, NEDLAC, must consider where there is significant changes to social and economic policy. so in terms of that, Honorable Chair, we would be keen to, we hear that there's been letters written. I mean, I'm sure those can be referred to us to have a look at what specifically are the issues which NETLEC is still raising. And then, like as we deal with any policy matter, we remain available to engage, whether, I mean, even as an example, even now, for instance, that the NHI has been signed into an act assented to by the president. We're still consulting. There's still various constituencies who are raising issues, and we're continuing to engage them. So in this regard, even as the act is now in the hands of Parliament, if they are, I mean, acknowledging from our side that we have complied with what the law says, but in the spirit of engagement, if maybe there are issues which, if those who are here, there's been public statements, it would not be out of sync to engage and hear what are the issues which a sector like still has to raise, but not in the sense that there has been any a deviation from what the law actually prescribes. But the other parts, I think a number of members have been suggesting that NETLEC be invited to the committee. I think that's really out of our hands in terms of whether NETLEC gets invited to the committee. But I think on our side, what I want to emphasize is that the door is never closed on any policy matter in terms of engaging with any sector. So that would be our approach. Thank you very much, Honorable Chair.
Let me get these two members who wanted to say something. Honorable Van Staden and Honorable Dr. Letlhape.
Thank you, Chairperson. Chairperson, this is a matter of procedure. And, I was the first one of the committee when you were still the Deputy Minister when the bill came before this committee. I was the first one to stand up in the committee to say, to state it publicly that smoking is bad and that attention must be given to that. But we mustn't, there's a matter of procedure which is going in a wrong way here. As I understand it, NETLEC are not the ones who make presentations. NETLEC must first handle the bill clause by clause, then they must submit a report, then it must be sent to Parliament. I agree 100% with Honorable Zungula. So we must be, and that's why I sent this letter to you on the 20th of September to say we must be procedural, handle this matter procedural correctly. Otherwise, we're gonna, as a committee, gonna face consequences which we have to answer for, and that is what I'm trying to stop at this moment. So, according to, and I stand by my point of view, why have we been told as a committee on the 4th that NETLEC has been consulted, and 2 days after that they issue a statement to say in the media that they were not consulted? Why did we also, you received letters yesterday as Parliament as well from Business Unity South Africa on the same matter and the same concerns? All I'm saying is we must be procedurally correct, otherwise we're going to land in court and we're going to face the consequences, and we must because we are the responsible members of this committee. So I would suggest, Chairperson, that let's get NETLEC here before we continue with our public hearings, and that we can sort out this matter of misunderstanding, because currently we only have a department here. So let NETLEC also come so that we can have discussions with them and to get further clarity on this matter. Thank you.
Honorable Dr. Letlhape, that will be the last hand. We won't take Honorable Zungula, Michael, and you incorporate your discussion when you take the second part. We won't take your hands now. Honorable Letlhape will be the last hand on this. Then I'll make my ruling on the matter then.
My hand was up. long time ago, and
No,
I think
you are the one who had the longest contribution. No, Honorable Zungula, I will not take you now. If you want to accommodate, you will send it when we are dealing with the second item, the actual bill, not now.
Chair, I think it's not fair that you give
That's
people
fine.
2 bites and you give other people only 1
Honorable
bite.
Dr. Letlape.
Thank you, Chair. I just want to be guided on process. Because my impression would be that NEDLEC, like any other structure, can ask to have an audience with the committee. I would be concerned if NEDLEC gets chosen and invited by the committee, because we'd be setting a precedent, say, on what basis? Why was so-and-so not invited? Why was so-and-so not invited? And that would create a problem. So I would know what the process is and what the guidelines are. And clearly, Chair, there should be a separation between the interaction between the DOH and NEDLEC. And from what has been presented, that has not been taken to its logical conclusion. That is not a matter between us and NEDLEC. It's a matter between the DOH and NEDLEC. Because from my understanding, they should have agreed to disagree on this clause by clause, but they agreed that there would be a clause by clause. That has not happened. Whoever is responsible for that, that needs to be concluded between the two parties. Because we don't want to be in a position where as a committee, we now need to do a clause by clause engagement with NEDLEC, when it's a parliamentary structure that should have interacted to its satisfaction with the Department of Health. And that needs to be sorted out. What I need to be educated on, Chair, is that if that is judged not to have been completed, that process, what impact does it have on the proper legislative process? We've been sent a letter where NEDLEC says this matter has gone to cabinet, but we have not completed our engagement with the Department of Health. And it's out there. What was the response of the department to that letter from NEDLEC? Because yes, you've met twice, but you have not concluded your business in terms of your agreement. And we, as a PC in health, should not be party to those issues. We should know what the outcomes of those discussions are. And there should be an avenue where NEDLEC can ask to come and see the committee, and we will happily engage. But the process between NEDLEC and the department has not been properly concluded in accordance with what Ms. Hunter has presented. That their understanding was that, oh yes, you can do a clause by clause. But there was no agreement between the parties as to how they take that process forward. And that needs to be done. But that's a department's issue. For us on our side, the question I'm asking is, what impact does that have of an incompleted process between NEDLEC and the department on the legislative process? That's the question that I'm asking. Thank you, Chair.
Okay. Honorable members, those who've got their hands, you can lower your hands. I'm not going to give you a space again. The conclusion of this matter is that I've just made an appointment to see the House Chair at 2:00 today, in line with these last comments of Dr. Letlape, to say this matter that seems to be a sore point between the department and NEDLEC is entangling us. What should we do? Should we get NEDLEC to us, or should we say at the right time they will come and make a presentation, so we will then be able to make conclusions? So there's no, because we are now leaning on saying it's the voice of the department alone without NEDLEC. Fine. Let us therefore find a common ground that says, of course, through the guidance, because there is a clause that says before Parliament. So I'm going to see, I've made an appointment accepted for 2:00 to see the House Chair, which way to go. See NEDLEC or encourage NEDLEC and the department to find themselves while we are dealing with the processes of before or after. So that part will finalize, honorable members, and I'll report back to you maybe through our chat as what will ensue between the advice that I'll get from the House Chair with regards to this matter. Well clear, well articulated. Honorable Dr. Letlape was saying this matter is hanging there between the department and NETLAC. And it seems on the view of NETLAC, the matter has not been well concluded between the two of them. What impact will it have on us as the parliamentarians on this matter? That part I will get to be praised and advised in this afternoon's meeting. Okay. Thank you very much. Now, honorable members, if you still want to comment, you'll comment on this second part. We are therefore saying, with all that's said and done, we will one day complete or go on with the public hearings on the bill. There is a good understanding that must take place between ourselves and all members, so that when we do public hearings, without the department being with us there, we can be able to deal with that very comprehensively. I've made a request, honorable members, that you present to the portfolio, to the department minister and this team, some of the issues that they would raise. When we raise them, they will come back to us as part of their presentation to actually, because we have had this bill before, they have brought back the bill as is, so we need to actually interrogate with it with questions. I'll start with my questions because I've read it and prepared it. Number one, and I please, Ms. Lerato and the team, please write this down, Ms. Janet Hunter. One, my understanding is that this bill is tobacco products and electronic delivery systems. So it actually talks about a two-in-one. There's been other members who have said, why two-in-one? Why do you not separate? Strengthen my understanding and educate me why you are putting it together. Number two, as probably I'll be speaking on this bill on introductions in public hearings, I've learned from this bill that it's a control bill, not a ban. So it is a bill that tends to control, wants to decrease the demand and supply with the hope that it will decrease the harm on health. But in this bill that talks about control, there are specific things that it talks to. One, it calls for a banning on vending machines, and reasons are being given there. Anybody can go and do. Number two, it calls about the banning of displays at the point of sale. And you go on to say this bill is brought in because the current act that was once hailed by everybody in the world is now overtaken by the innovations that come from the industry. You also go on to talk about you want to have a ban on both nicotine products and those that are without nicotine, on the basis that you will not be able to separate the face value, has this or has this not got nicotine. You must actually strengthen that type of a presentation, and one must listen to again. What will not going to be to disappear, Deputy Minister, is that you are putting regulations on what would be a legal, official tobacco company, and you are not inviting, we don't hear the voice strongly, so inviting those government entities or departments that have something to do with illicit trading. And therefore, if you don't get that voice championed by some of the colleagues or the people who are supposed to deal with that matter, and you supporting it, it will actually be like you are trying to penalize those, or you are trying to put regulations for those who are complying with the law, but you are not putting in place anything to do with it. So when you're putting this bill, it will be very difficult not to hear your voice and your actions on illicit trading with those who lead in this process. Granted, there is revenue that we receive from tobacco. Maybe you could quantify if you do, but you need to compare that also and show what actually is the loss or the expenditure that, or what is then used up to counteract that revenue in terms of cleaning up the impact of tobacco. Is it in the long, healthy lifestyle, health and absenteeism at work? There has been somebody, some people are saying the absence of adverts has had an impact in decreasing exposure, and therefore in the 1990s decreased the uptake of tobacco. And therefore you need to actually be able to expand and whether confirm or that is actually something one would like to know. I would like you to come back, Minister, and your team, when all other members have raised, and therefore your presentation must be incorporating, maybe focusing on these ones, because this presentation you have has actually come to us. May I then get members who would be willing to talk to this bill in the way that I have also raised my concerns and my questions? And these hands that I've seen, there are hands that are addressing just that. Let me just see which one comes first. Honorable Zungula, Honorable Mutubatse, in that order, Honorable Kayako, Honorable Van Staden, Honorable Clark. Those are the ones I've seen. Okay, then Honorable
Shabangu.
Etlape, Honorable Shabangu. Okay. Come through, honorable members, in that order. Okay.
Thank you, Chair. Earlier you said that what I wanted to raise, I can quickly put it in when you are giving us an opportunity now. So I'm going to start by concluding on the network issue. I've got a letter here from the Executive Director to the department where the network there, Executive Director of network, whereby it was saying that they are requesting that the department provides clarity on the implication of the cabinet statement quoted above in relation to the processes for consideration of the bill at NEDLAC and in Parliament. That was the letter. I've already shared it on the group, but I'll also put it here on this platform. And then there was a response from the Acting Director of Health, where it is where the Acting Director says it is therefore the view that the establishment of the proposed task team be put on hold pending the finalization of the legislative processes. The department will reconsider the establishment of a task team once it is evident that the legislative process has still not addressed the concerns of the relevant stakeholders. So there, Chair, I wanted to put it there on record that all the members know that there was a request by NEDLAC, which was shot down by the department. And here, Chair, again, I think the mistake we must not make is not to equate NEDLAC to any other business forum or social forum, because you can't compare NEDLAC with a forum that is dealing with the sale of cigarettes somewhere, because whatever forum that would exist there, it's not a creation of Parliament. But with NEDLAC, there is a legislative process. That is why if in the NEDLAC Act, it is saying that the consultation must be done prior or before the commencement of the Parliament process. That is why, Chair, I would also propose that please seek legal advice from the Legal Division of Parliament to check that in light of this information that is now before the committee, what then becomes the status of the 7 public hearings that were done in the other provinces and going forward, to avoid a case whereby the committee just goes and only later realizes or is given information to say those public hearings were done and they were violating the processes of the NEDLAC Act, which is the processes of Parliament, because NEDLAC is a creation of Parliament. That is what I wanted to conclude. The questions that I have for the department on this one, firstly, is on the socio-economic impact report. When was the report done? I know in the last meeting, I think in September, the answer was about 2022, whereas with the information that is before me, the published version is from 2018, which makes it a problem because if the last socioeconomic assessment report is from 2018, it was before the advent of COVID or the lockdowns, which had changed a lot of things in the economy in the country. And again, the problem is that we cannot, it would be highly reckless to continue with a bill that is basing the socioeconomic study of more than 6 years ago, because 2018 is not something that is recent. And then also, Chair, on the question of the illicit trade, we know that when we asked this, the department answered and said, the illicit trade, it is a question of the law enforcement agencies, which is correct. However, if the issue that the bill is trying to address is a question of the impact of smoking on the public health system, therefore, we cannot turn a blind eye as to say what then becomes the strategy of the bill to deal with the illicit trade as it accounts reportedly close to 70% of the smoking in our country. Therefore, there needs to be something that is said not from the perspective of law enforcement, but from the perspective of to say, here's a problem of illicit tobacco trade that is impacting the public health system. What then becomes the solution to that? Because we saw even during the times of COVID that over-regulation ends up leading to an unfortunate instances whereby there's an increase in illicit tobacco trade. Therefore, we need to be alive with those realities. We can't have a bill that, yes, correctly seeks to want to address a problem, but because it is not taking into account the problem of illicit trade, then creates a problem in that regard as well. Then the other question that we want to put, Chair, is what proportion of smokers are actually expected to quit smoking if the bill is passed in its current form? And how is this success squared against the explosion of the illicit market? And then the last question is, what is the projected impact on the tobacco value chain, agriculture, which is around Limpopo, and the processing, and as well as the manufacturing? And then the last thing, I know I just said the last thing now, I think, Chair, the issue concerning how the bill will impact the informal traders needs to be taken into account. The question of having over 2.2 million South African citizens dependent on the tobacco trade or the cigarette trades, in light of the high levels of unemployment and poverty, needs to be taken into account. It cannot be that we are going to have, because there's one government, Chair, we don't have different governments. One is only focusing on health, another is focusing on creating employment, another on law enforcement. There needs to be considerations by the bill to say, by the department to say, how is this bill going to deal with the questions of the 2.2 million South African citizens who are trading in that space for survival. And therefore, if it happens that this bill now gets to be passed, what happens now to the 2.2 million people in terms of their livelihoods? Because we know in other sectors, you've got the questions of alcohol. They are classified differently because there's also different risk levels. Similarly with sugar, there's different classifications because there's different risk levels. You go to the townships, go to many areas, there's so many outlets that have got liquor licenses, even though the evidence is there as to how much the liquor sales get to impact on the questions of crime, on the questions of the public health system. But there are considerations more than one singular item because there is so much that needs to be considered. Therefore, it becomes important that the bill does take into account everything instead of only one item. Thank you, Chair.
Honorable Motubat.
Oh, thanks very much, Chair. I think in rounding up the NEDLAC debate, I think I'll agree with dual processes. Chairperson, go and actually consult with the chair regarding this particular matter, but emphasize on the legal aspect of it. And just to emphasize that there must not be any illusion from any person that as we want this process to go through, therefore, we are actually in support of, if we are to make a choice between life and profit. If I have to make that particular choice in this regard, the MK party will make a choice on life. I think that must actually be made clear. We're just dealing with these processes so that we must satisfy the legal processes. But coming back to the debate on question now, just from the department on the inside, what is our posture regarding the decrease on smoking in view of the 1.27 billion target that has been set to try and contribute? What is the contribution that has been set nationally by the South African government to reduce smoking by 2025? And is there any target that has actually been set, of course, within the context of the bill, that in the near future, we can set up a target to achieve the 30% that has been set in the past? Because the 30% that was set to 2025. Is there any sense or any view that this is where we're actually moving to? Because we must actually make a choice as to whether we want to be a non-smoking country or we are an anti-smoking country. And I think if we are a non-smoking country, we will not actually be concerned about setting out those targets and moving towards the elimination completely. But then if we are an anti-smoking country, I think all the issues that are actually located within the bill, in particular, in respect of what actually encourages people to smoke. And smoking will actually have to do with nicotine. Now, the question would be, what would be our attitude towards the control if we are moving towards the anti-smoking and meeting the targets within the SDG goals? What would be our targets? And shouldn't we actually consider controlling the nicotine that actually goes into our products? Simply saying, can we at some point move towards saying we are a nicotine-free country and therefore our products should not actually have nicotine? What would be the fear to move in that direction? Would be the fear that if we do that, will actually be increasing, or illicit trading will actually come in, or people will actually smoke behind closed doors, or we are afraid because we are succumbing to business in this regard. Thank you, Chairperson.
Thank you. Honorable Teko.
Yes, Honorable Chair. Thank you very much for giving me the opportunity to have a second bite on the issue. Chair, you raised two things, which I think I will comment on one, because what you recommended to the department regarding the bill, I will summarily say it must be considered. Regarding the process, Chair, I want to say I am that person that believes in a broad consultation. I am that person that like to get the views of the general public. I wanted to recommend that if 7 provinces were visited. There were public hearings in 7 provinces. Let us not deny the 2 remaining provinces a chance to voice out their views regarding the bill. If we are a people's parliament, let's get the views of the people from all provinces. Also, we will, after that, get presentations from organized groups and individuals, where I think it's also another step to get views of those stakeholders and individuals. But Chair, I think we have used most of our time discussing what does not concern us, what is not in front of us as a portfolio committee, the issues between NEDLAC and the department, and there is nothing in front of the committee. I second your proposal to say you would write to NEDLAC to check if they want to come and make a presentation, which I agree with you. If NEDLAC must be advised to consult Parliament directly, there are ways arranged formally that anyone who would like to consult Parliament has a way to direct that communication if he wants to be entertained in a parliamentary process. Chair, I think the program that we have agreed upon as a committee must not be taken away. It must be followed. It must be concluded. The 2 remaining provinces must be visited during this process of this, the processing of the bill. That's my take, Chair. I recommend that the program be completed, the views of people from all 9 provinces be entertained by this committee. After that, we will follow the next phase of the processing of this bill. Thank you very much, Chair. I welcome what you have recommended to the department. I welcome that you are to write to NEDLAC to say they may, if there are anything that they want to raise with us as a committee, I welcome that. But I stress on the issue of just visiting the 2 remaining provinces so that we can, in summary, say, this is what South Africans are saying about this bill, and conclude to say there has been a say by Parliament to say tobacco use must be controlled in order to protect public health. Thank you very much, Chair.
Thank you, Honorable Van Staden.
Chief, thank you very much. Now everything we are discussing here is concerning us. There's nothing that we do not discuss here that does not concern us. We won't discuss matters which is not a concerning matter. So that's, I just want to clear that. I've actually put a proposal on, I've actually tabled a proposal to set, and we haven't dealt on this matter yet. But I've said earlier this morning after I've said how I see the procedure must be dealt with, to say that let's hold for a moment what we are busy with until we get the confusing sorted out between the department and NEDLAC. So that was a proposal I've made put on the table. So we need to give attention to it, please, Chairperson. But I hear what you say, that you will speak to the House Chairperson this afternoon. I think you must do that, but you must please come and give us feedback on that matter as soon as possible before we go into the 1st of November program. So all I'm saying is that we must sort these matters out before we go on with any programs and stuff. I'm not going to ask the department any questions now. I've asked many questions on the 4th of September and the dates before and the dates before. Yeah, I stand with my view that we must just hold for a moment before we carry on with anything until this matter has been resolved. And I've already put this proposal on the table. Thank you.
honorable members, so that we don't go back to this again, I've indicated to this platform that at 2:00 I have asked for a meeting with the House Chair, and he has gladly accepted that. I'm going to therefore check and raise your views, including what Honorable Dr. Letlape is saying, make very emphasis on the legal part of this matter, because while this matter is Department of Health NEDLAC, but what does it do to us? Those things I'm raising. So let's not go back to that now. I am having a meeting at 2:00 with the House Chair, emanating from this portfolio committee discussion. Honorable Honorable Clark.
Thank you, Chairperson. Yes, so we'll wait for you once you have sorted the legalities out in terms of the NEDLAC issue, because that's something that really concerns all of us. And then I also would ask that we get a presentation from the department in terms of real-time stats, how harm reduction differs from tobacco, nicotine smoking, and electronic system, because it would be very nice to compare those two, and we haven't seen that as yet. And then the rest of the issues that I was going to raise, Chairperson, you have raised going forward, and that you will deal with that and give us feedback. Thank you.
Thank you. Honorable Dr. Letlape.
Thank you, Chair. Just a few things. Part of it goes to what Honorable Clark has been talking about. The issue about nicotine, degree of harm from nicotine, because I know the position of the department, as espoused by the legal representative at the last meeting, is that harm is harm. Why does harm reduction not apply to tobacco when we apply it to other things, heroin, cocaine, alcoholism, other substance abuses? Why does it not apply to tobacco? And just to bring to the attention of the department that vapes do not come from the industry. The modern vape was invented by a pharmacist from Hong Kong. The industry produces other innovations like heat not burn. Snus is a tobacco product. Nicotine pouches were not a product of a cigarette company. Why is there no differentiation in the bill about these different products and the degrees of harm that they cause? And just kindly explain the reason for the friendly attitude of the department to dagga that is being decriminalized, and we're aiming to industrialize production, despite marijuana being more harmful than tobacco. I mean, cannabis is to marijuana what nicotine is to tobacco. So I wonder why we progressive on the dagga side and we retrogressive on the tobacco side. There's an urgent bill for a new bill because of the innovation and the need to curb youth uptake. So a new bill is needed, but it has to be based on science, not on belief systems. Now, lastly, we have more than 20,000 tobacco-related deaths per annum. And one of the SDG goals is to reduce preventable deaths. These alternatives have been shown to provide hope and to reduce the number of deaths for nicotine dependency. What is there in this bill that enables us to give adults that can quit alternatives that are less harmful? Youth uptake is a major problem, and that's why we need regulation. We need things are being sold from everywhere with no regulations. We need it desperately, but it has to be based on science, and we must not forget that we have over 12 million people that continue to smoke despite the hazards of smoking, and we owe it to them, if they can't quit, to provide them with safer, with less harmful alternatives that are properly regulated, so that we ensure that they are not harmful and it is based on clinical evidence, and we still prevent youth uptake. Thank you, Chair.
Thank you. Honorable Shabangu.
Chair, thanks. I'm covered. Thank you, Chair.
Thank you. Honorable Mutubati.
No, I think the issues that I raised earlier, I think you recognized me twice. You love me
Oh,
today.
no. Yes, you have come up with number 2. Sorry, yeah. No, I'm sorry.
Yeah, I was number 2. No, I appreciate the love today.
Yeah, Minister, come back with your department to prepare us in this space. Maybe while members are there, I will then come in just to conclude with the way forward, because we are not saying we are going to completely abandon the situation, even the meeting this afternoon. But Minister, come in and sort out and support us on your responses. And your presentation must be sort of in line with the questions asked by members, so that you mainly focus on that. We do understand the bill, but these are the questions that members have raised that I think you need to zoom into them in your responses. Thank you very much.
No, thanks, Chair, and thanks to the members. Chair, I think while we had also prepared some slides, at this stage, I'm more inclined that I invite the team. I'm hoping that Ms. Hunter, you're able to, together with the team, Ms. Lurato Mahura and Advocate Mabelo, and all other members who are here. I hope that I've made some notes, but I'm hoping that you've also done so. I think it will be a lot more helpful to speak to the issues which have been raised, rather than, as much as we try to anticipate and focus on a few slides. But I think it might just sort of take us back to a rather more generic, rather than try to deal with some of the issues which have been raised. Can I, Ms. Hunter, are you able to maybe just yourself and the team, and then I'll come in. If you could just, starting with the matters which the chair has raised, for instance, on the reason why we've combined the bill. I think it's also the same matter is also raised by Honorable Dr. Letlape as well, and the issues around illicit trade, the issues on the impact on the economy, and there are quite a number of matters which were raised by Honorable Zungula. So can I just check, Honorable, with Ms. Hunter, if we're able to just share the responses, then I'll look at where there are gaps, and then I'll come in where there seem to be gaps which I can fill in. Chair,
Thank
so
you.
that, yeah, I thought we should rather just go straight into trying to respond to the matters raised, rather than go on a generic kind of a presentation. Ms. Hunter.
Yes, thank you, Deputy Minister. That makes more sense. And thank you to the Chair and the honorable members for the opportunity to respond. So to my colleagues, because we are not all in one room, I will respond to a number of the questions, but as I pass questions, I will indicate which should be responded to by Ms. Mahura and which by the advocate. So Ms. Mahura, if you could just, as Deputy Minister says, it's really not necessary for us to flag our whole presentation that we did, but to speak to the issues. So the issue on why do we not separate the two, we talk about the tobacco products and the electronic systems delivery bill. Ms. Mahura will speak to that. I'm going to respond to the chairperson's next question to confirm that the content of this bill speaks to the control of tobacco products and the products related to the electronic systems, electronic delivery systems. It is not a ban on tobacco production and the sale of tobacco products. And in this regard, it is control to protect the vulnerable in the community. It is to protect our youth. And therefore, the bill speaks to issues of plain packaging to stop making this harmful product attractive to young people, to children and young people, whether we are talking about tobacco or electronic products, to stop making it attractive, to stop making it easy for people to buy and for people to do impulsive buying, because these are now at the checkout aisles and not in a specific section of a retailer, so that those who deliberately want to buy tobacco and are of age to do that legally can do that and not make it attractive. And oh, by the way, I should probably try this out, as young people are inclined to do. Ms. Maura will also speak to the issue of illicit trading. And then if the Deputy Minister agrees and the chair person allows us, we would like to send a written report to the Portfolio Committee on the revenue that how does the revenue that we receive through tobacco, how is it offset by the cost of treating people down the line who have conditions that were caused by tobacco use? Because we would like to write a report and also refer in the report to research, to peer-reviewed research that's been done on that area. Honorable Chair, on the socio-economic impact report, that report deals with the period of 2020 to 2022, but it is unfortunately 2018, it's a typo. But we cannot expect the Portfolio Committee to take our word for it. So we have to go back to the research section within the presidency that approves SIA's reports. And we'll ask them if they could certify what I'm saying through a letter that will then allow us to correct the date, because we cannot be seen to unilaterally correct that date. It may be seen as fraud. We will need them to back us up to say they do agree that the review was done for the period 2020 to 2022. And we will then deal with it like that, Chairperson. Then there was a question about what is our posture regarding whether we want to be known as a non-smoking country or a country that wants to reduce smoking. One of the honorable members had earlier reminded us that South Africa is a democracy. We find ourselves in a position where tobacco products are legally sold in this country and used under certain conditions. And I think it's small steps at a time. It will be biting off too much to suddenly wake up one morning and put a total ban on smoking. We did it as government during COVID, but COVID was a very special condition that called for special measures. And this is why with this bill, we're just asking for control on packaging, on sale, and a number of other issues. As we presented to the committee last time, we had a whole slide on what exactly is this bill changing in the current environment. And so we're looking at control at the moment, and I want to link this response to the question that was also asked. What targets are we setting? We are not setting targets. There would be scenarios that scientists would model, and we could also provide that when we do the written report on revenue from tobacco versus how that revenue is offset actually and negated through what it will cost, what it currently already costs the country, and what it will cost the country into the future to treat conditions that are caused by smoking. We could include that modeling. That's why there's often questions from the portfolio committee, even in terms of our sugar tax, the reduction of salt, and for tobacco, they're saying that this is a public health issue. And you see the results over time with this. But if we look at our history in terms of when we first put a ban on the advertising of tobacco products, how smoking decreased up to 2013. And then because of the introduction of the new products, which is these electronic delivery systems, you can see how smoking in this country has increased. So the content of the bill is based on research that shows that interventions such as what we want to apply through the bill, what positive effects it had in other countries, but we can also look back on our own country's history and see that legislation has made an impact in people stopping smoking. I continue. Yeah, I responded to that one. Then there was the question from Dr. Leklapi, the Honorable Member, Dr. Leklapi, that was talking about harm and the degrees of harm, and asking why we are so friendly towards DAGA. And so I would, that is we will remember that to legalize DAGA under certain conditions in this country was not a decision that was arrived at easily. There were also legal challenges around that, and this is where we are now. And so it is focusing on certain areas and attempting to improve the environment step by step. And research is showing the harm, not just from tobacco products, but from the related products, tobacco-related products, such as the electronic delivery systems. And this is why, as a health sector, why we are focusing on that one. So just to recap the issues that Ms. Maura would be able to explain much better than me is why are both types of products now being addressed in the bill. She will also talk about the fact that we are not casting a blind eye to the dangers of illicit trading. She will talk about that one. And I think otherwise I have covered to the best of my ability. The Deputy Minister will assist where he believes we have left gaps in our responses. And so let me hand over to Ms. Maura, Chairperson. Thank you very much.
Thank you very much, DDG. The issue regarding why are we having electronic delivery systems as well as tobacco products in one bill, I think we discussed that at our previous sitting on the 4th of September. As we all know that South Africa ratified the WHO Framework Convention on Tobacco Control, there was a slide in the September 4 presentation, and we said that we have an obligation to implement this treaty. And at the same time, we even said the Conference of Parties meeting, COP10, made a decision and actually encouraged parties to implement measures that goes beyond the required convention issues and protocols. And COP10 also urges parties to remain vigilant and monitor the market presence and marketing strategies used for all tobacco products, including the newer ones, your vapes, or the ones that are included for harm reduction. Now, we also felt as a country, because we have the responsibility of protecting public health. Remember, these products are doing harm to the people, to the users. So it is part of including going beyond the measures of control, going beyond what you already have in place to protect people from being harmed. And illicit trade, if you look at illicit trade issues from the health perspective, we know that when cigarettes are provided or whatever, mainly cigarettes, that is part of the illicit trade, and we still have to also look at other products and study them further to see if they are available at that level. But what we have knowledge of is that when you provide cigarettes at a cheaper price, for instance, they become, if they are affordable to people, it means that people are going to access them more, and then it also encourages initiation, and it encourages people to keep on coming back because they're getting the products at a cheaper price. But from the SARS point of view, we know that it has to do with tax evasion issues. But all that we are saying as the department is that we do acknowledge that we need a track and tracing system that will help us to curb illicit trade, not only speaking about revenue issues. And we know that if, let's say, products are not declared, then the country will lose on revenue. But it is not to our advantage when everybody has access to cheaper cigarettes, because it means addiction, it means more problems to the health sector. And I'm not too sure which other question am I supposed to answer?
Did you speak to illicit trade?
Economy.
No, the
illicit
economy,
trade, I just
economy we
yes,
can
I just
writing, yeah.
With regards to the economic issues, the only few things that we're saying is that I think people should be given adequate education around the fact that it's not all the time that we are gaining from the tobacco industry. They do give revenue, but we should also look at the fact that there are losses here and there. Let me just make an example. For every R1 in cigarette sale, it costs the society R1.50. If you look at the economics of cigarette sales. So for every R1 that SARS received in the form of cigarette excise tax that was in 2016, it means that the society would then lose around R3.43. So we know that smoking is responsible for over 14 billion in health expenditure, or 4.1% of the overall health expenditure. So those are the things that we should also be looking at. And the other thing that we are also trying to say as the department is that since we are not banning these products, it means the drop in prevalence will take place over a period of time, allowing the economy to adjust. So as that happens, the consumers will then shift from spending on other industries, not necessarily spend on the tobacco industry. So we also had a study in the GET study that we had in 2021. What came out is that heavy smokers are spending around 263 Rand per month on manufactured cigarettes. What it means is that if you, for instance, give a smoker a social relief of 350, it was 350 in 2021, I know it's now 370, it means that if you are a heavy smoker, you would have spent 263 per month on manufactured cigarettes. So those are the things that we would be advocating and we would be looking at in terms of the economy. Thank you, DDG.
Thank you very much, Ms. Mahura. It looks like Ms. Hunter might be having connection problem. I saw at some stage a report which says she's left. I'm sure she will reconnect. Let me just pick up on some
Deputy
areas.
Minister, Deputy Minister, let me just say I'm back. Thank you. I got an alternative network solution. Thank you.
Okay, welcome back. Let me just make a few additions on what the team have said. On the, I think there's been an explanation, Chair, on why it's the bill is combining both the tobacco products, electronic delivery, and as the bill says, nicotine and non-nicotine electronic delivery systems. What we get guidance from is also from, as indicated from the WHO as signatories to the convention on the issues of tobacco. There's an acknowledgement that there's a lot of overlap in terms of the modern instruments, whether it be the vaping or also the electronic delivery systems. Some of them include the products which also include nicotine and also other products which in themselves are also harmful, and that's why our team came to the conclusion, therefore, after various consultations, that it would be cumbersome to separate, to create two bills, two legislative frameworks, because there's a lot of overlap. And at the end, as you would see, that it's to make sure that it covers the whole spectrum in terms of the changing devices and the manner in which also the advertisement, the exposure, and all that there's a lot of overlap from the old systems, from the historic traditional systems of tobacco combustion into the new systems. So it was going to be quite cumbersome to then try to do a separation, rather one bill which looks at the control of various aspects, especially in terms of the advertising and exposure and protection, especially to vulnerable groups. The issue of illicit trade we take quite seriously, in acknowledging the fact that as yourself, the chair, and also other members also raised that. This is a matter which we quite conscious of the fact that if you only focus on those who are trading legally but don't really reinforce or seriously intervene in terms of the illicit trade, that will just be a counter-offensive in a way. It would be counterproductive, rather. So concurrently, as a Ministry and Department of Health, we pledge and commit to working with our colleagues in other law enforcement, including SARS, the police, in terms of the available systems which have been developed internationally, which have been discussed, and there's been some issues around the cost of some of those tried and tested tracking and tracing systems, which can help quite a lot in terms of reducing, if not completely eliminating, the whole big industry, which is the illicit cigarette, especially illicit tobacco products, and especially illicit trade in cigarettes, which we agree with the members that it's a very serious risk, and therefore we are not underestimating that, and we're making all efforts to make sure that working with our other colleagues within the state, we can use all the tools available. Of course, some of those we can only do up to the extent of what the country can afford, but the cost in terms of, not just in terms of the fiscus, but also in terms of the health, which is our main focus, the public health, it will, if we don't make a huge intervention in that regard, it will nullify most of the work which we are doing in this regard. There were issues raised. I know the team did touch on that. On the economic side, I think a number of members in different ways raised the issue in terms of the value, the economic value chain, going into small traders and the whole value chain. What we're looking at here is again that it's because of the serious health impact of these products, which really neutralize in a way the economic gain. What's going to be important is that working together, and again we work within the framework which is not unique to the country, but also a framework which is also guided by experience in various parts of the world and under the auspices of the World Health Organization. There has been advice and efforts, from the farming side in terms of looking at alternative crops, and the call on governments to make sure that farmers who largely traditionally have been tobacco farmers should be assisted, firstly in terms of alternative crops, especially those which will provide positively income, but also positively in terms of nutrition to the citizens. But also, of course, there might be argument that there's certain kinds of soil which maybe traditionally have proven to only be good for those kind of tobacco products in terms of farming. There's been a lot of work also done in terms of looking at whether those leaves could be also used in terms of other alternative gains to the economy, where it might not be easy to change the crops immediately, whether in terms of the biofuels and other products of industry, which some of those products can be used. At the trading level, in terms of small traders, again, because at the end, what we would want to see is to progressively, as we have seen in the mid-90s when the first legislations were brought in, the steady reduction in the number of new smokers and also those who are quitting smoking. The issue here is to, again, work with those, including the small traders, to look at other alternatives through which people can still be able to be in retail and be able to sell other products. Honorable members would know that, for instance, the same outcry was there when the advertising of tobacco legislation was introduced, where a number of sporting cultural events were sponsored by tobacco companies. And there was a huge concern that with the stopping of those advertising of tobacco products and therefore prohibition on them being able to sponsor cultural and sporting activities, that some of those would collapse. But the reality is that as soon as that happened, those industries, sporting, cultural, other industries started growing and were able to take that space. And therefore, what we're looking at is that working with our other colleagues in trade and industry, small business, we should be able to be looking at other alternative merchandise through which the small traders who traditionally have made their living out of selling these products will be able to adjust and find other products, other merchandises which they will be able to trade in. In terms of, there were questions about the proportion of what is our projections in terms of the extent to which many people can quit smoking. Really, at this stage, we can only learn from the earlier interventions, the numbers which have shown the extent to which we're able to gain reduction, and the fact that the current, if we can claw back, the lost ground where there had been in the earlier years up to 20 to 30% reduction, and what we're looking forward for is that with these measures we can be able to recover those. Lastly, the issue of cannabis, Honorable Dr. Letlape, you would be aware that even the legal process which has resulted in the Department of Justice having to introduce legislation following the Constitutional Court ruling on private use of cannabis. This was not driven from a health perspective, but it is other arms of state, including the courts, where individual members of society have applied to the courts in terms of looking at other constitutional rights. So it is not as if, it is not that from as far as from the health sector is concerned, we still very much concerned in terms of the negative, psychotropic effects of cannabis within the whole issue of introduction from cannabis, where there's also a lot of evidence that a number of people firstly will come through introduced to cannabis and then end up at very hard drugs. So this is still a matter of concern from a health perspective. So of course we have to also abide by the legal prescripts which our courts have made particular rulings, and make sure that within that we can be able to still do the best we can to protect the lives of our people. I think I'll leave it there, Honorable Chair. I think we have tried to deal with the issues which the honorable members have raised. Thank you.
No, thank you very much, Minister. Honorable members, we have received quite a lengthy response from the department supporting us, because when we have cleared up these issues that we are talking about, we will be expected to do some public hearings. Let me start before, as I summarize. We would want to note that the legacy report told us there are 7 provinces who have had public hearings. We will have to confirm with the leadership of Parliament that those meetings were legitimate, they hold constitutionally and legally. If not, then they will tell us differently. But just to allay the members to close up that space, which in fact is what we are familiar what happened. Those who were here, the portfolio committee went to 7 provinces and did three public hearings per province, except for Western Cape and Free State. So if we were to then be uniform in our approach, it means over and above the 2 provinces, there'll still be an expectation that there should be 1 public hearing in the Western Cape and 1 more in the Free State. If then we were to consider that those 7 provinces have been done properly. Now, the planning of starting the public hearings is underway. Safe to say that the meeting that I'm going to have with the House Chair will add or input on that or amend the plans. But I want to indicate that to the members, we will have a report back to the meeting, to the members here, probably a very easy Zoom meeting to report. You could forward the report, but if members would want to interact with whatever discussion that would have emanated, we will do so. Yeah, thanks, Minister, that you will not really lose the focus on this issue of illicit trade. Rightfully so, to say we are trying to control and enforce on those who are law-abiding, and therefore you would then rally other law enforcement agencies to make sure that you work around this space. And we will then say we have had a reasonable exposure to what you have actually been asking us as parliamentarians to work around, and we will take it from that process. But if that is allowed, members, thank you very much for your engagement. And I hope the debate that was started, hot as it was, has had a very good ending, that we are collectively agreeing. Let us err on the side of consulting with the leadership of Parliament and make sure that we are within the space of legal framework in the process going forward. Now, I noticed that there's one member who still wants to speak. Honorable Motubate.
No, thanks, Chair. Chair, I appreciate the contributions that are there, but then I'm disturbed, and I want to encourage members of the department that we must not be cajoled and make the public to think that we are in a hurry in dealing with this issue of cigarette and smoking. This issue started in 1993. We are in fact late. We are not in a hurry. And at some point when we make these inputs, we must actually be serious around the issue of saving lives. And I would encourage through the Deputy Minister that we set very clear targets and demonstrate to the United Nations, because we are signatories, to say that this is the target that we are setting ourselves, and put in place mechanisms to move towards those targets, including what we'll be doing. I think implement Empower in such a way that the department itself will be able to demonstrate its advocacy program and not rely on the public, but to say, this is our advocacy program within this particular area of dealing with smoking in order to save lives. And also the issue of nicotine, because all these other things, we can talk about all these other things, but they rally around nicotine because that's where the problem is. And I would encourage that we move and look strict into that particular issue of the reduction of nicotine if we are serious about this issue. Thanks, Chairperson.
Emphasis, Dr. Honorable Zungula.
Thank you, Chair. Mine is a question to you. There's the meeting that you are going to be having at 2 o'clock with the House of Chairs, noting that there's a very strong sentiment in the committee to say the public hearings or any other process must be paused pending the clarification or confirmation that if we proceed, or if the committee proceeds with public hearings, we will not be violating the acts or the processes of Parliament. So I want to check that in your meeting with the House Chair later on today, will you also be able to get like a proper written advice from the legal services of Parliament? Because there is a strong view, Chair, that the Network Act is very clear on the before part, before the processes of Parliament are ensued. There must be that consultation with the department, which in accordance to the letters we have now, that did not happen. That's the first one. The second issue is to ensure that even the 7 other provinces that were done, I think it will also help us, Chair, for the legal services to also advise if everything is in order, because it will be a shame, Chair, if we proceed only to find out there is wasteful expenditure because we ignored NETLEC. And the confirmation of the other public hearings being done correctly must not be just from our sentiment as the committee or the committee staff, but rather it must be informed by the legal services, as informed by the Mogale. They must base their views on the Mogale judgment, which clearly stated what informs proper consultative processes done by Parliament. So mine was just to ask those two things because there's a strong sentiment, and I want to agree with that sentiment to say, let's pause all the processes pending the legal services of Parliament actually okaying that all is above board, we can proceed, or there's few things that need to be corrected so that when we proceed, we do not risk any litigation from the side on the side of how the processes was followed. Thank you.
Honorable Zungula, exactly. That is the reason why, while we were in this meeting, I consulted with the chairperson and I requested an urgent meeting. Now, I am raising it there in that spirit. So all that, what would be his view, including a legal advice of Parliament in that space, okay? Let's leave that matter. It's going to be attended to. I would not have actually raised it so urgently that I need to have a meeting before we go into the sitting of the House, if it was not because of this meeting having raised that matter. Honorable Van Staden.
Just for the record, what Honorable Zungula said now, I'm supporting 100%, and we are waiting on feedback. Thank you very much.
We'll do that. Honorable Kweko.
Yes, Chair, but I think the summary that you put before covered me. But now that there are speakers that came after you, I think I must get in again to say there is no program that we are putting on hold. That was not the agreement from this meeting. But I give respect to what you have said to say you are to still engage the House Chair or leadership of Parliament regarding the legality of the bill. But I think we are continuing with the program that we adopted, unless a hold is put by the offices that you are to engage. Thank you. I just wanted to raise that, Chair, because when one member says there was consensus that we put on hold the program, there was never such, but there were views that from honorable members, differing views. Some must continue the program, and others saying, let's wait up until NETLEC is consulted and whatever. What I recommended is that you can invite NETLEC, you can do whatever that will make us, will make this process a transparent and according to law process. But I think we have a program that we adopted that is in front of us that we are still to implement. Thank you very much, Chair.
Honorable members, if there's still an amendment on the program that we have had, it will be because it is informed by the meeting that I have this afternoon and going forward, and you will be duly informed. So let us not rush to say the program is suspended or there's no program. We can't be a portfolio committee that has no program. But if that program is actually asked to be amended, so we will then report so that legally and administratively we are led within Parliament. And that's exactly what I'm saying. So I see now another hand. Are you saying something different, Honorable Clark?
No, Chairperson, I just want to say that we support you fully, going to consult with the chair and the legal department so we can get clarity. Thank you.
Thank you very much, honorable members. Do look up for the notice that will come from our portfolio committee secretary regarding when one can report properly back to you. I would imagine not just in a WhatsApp, probably in a formal meeting, which you can have sometime this week or early next week. Thank you very much. Have a good afternoon. Let's meet some of us who are going to the House in Parliament. Thank you, Deputy Minister, with your team. Thank you very much for those responses. We will still meet again for other programs. And thank you to those other South Africans who were part of this portfolio committee attendance. This meeting is now adjourned. Thank you.
Thank you very much.
Thank you, Chair.
Thanks, Chair.
Recording stopped.